a question. Are medications designed to heal? What do you guys think? You guys are shy this morning. No. They're designed to manage disease symptoms. They're disease-modifying drugs, right? I can be frank with you, right? How many of you are on at least one prescribed medication? Awesome. All right. So how long are you supposed to stay on those medications? Is that healthcare? Can we call that healthcare? We can call that disease management, certainly. It's managing a disease. Some people call it sick care. We are all consumers in a trillion-dollar industry. Do you guys think the industry is on our side? Agree with me. They want to keep us healthy enough to keep being a customer, but sick enough to always be a customer, this sort of dependency. So according to the World Health Organization, they agree, this is on the WHO's website, that there's an inherent conflict of interest between the legitimate business goals of providers and actually what's rational for us as consumers. We're not anti-medication and functional medicine at all, and some people are alive because of medications. We just ask the question, what is your most effective option that causes you the least amount of side effects? And for some people, medications fit that criteria. But for many people, it doesn't. They have lots of side effects, potentially. Have you watched a drug commercial before? You know, just because they say it in a chipper voice, like suicidal thoughts, cancer, so you can get like longer eyelashes or something. It's not the most effective, causing them the least amount of side effects. And people that are on medication all kind of said, well, we'll be on this forever, and typically in increasing doses, right? These are chronic degenerative issues typically. So what are good gauges for assessing your health? I talk to a lot of people, and a good icebreaker for my job is, how do you assess your health? How would you say it? And that amazes me how many people say, I'm in good health. And you look at their medication lists, they're not in good health. My friends, they don't put people on medications if they're in good health. Healthy people don't need medications. Or they'll say, other than my health problem, I'm in good health. It's quite a nice luxury to give yourself. But what they're really saying is, I feel okay. I can go to work. I can mow the lawn. I get by. Therefore, I'm in good health. So what are good gauges for assessing your health? Because how you feel isn't always a great predictor for assessing your health. About 50 to 70% of people who die from heart attack, their first symptom is the chest pain, and then they're gone. They felt fine up until the moment they're gone. Were they healthy the moment before that heart attack? No. These are chronic health problems that are typically silent. And we have to kind of look at what are good, accurate gauges, objective gauges for assessing our health. Number one, I would say our labs. Our labs aren't lying. And number two are medication lists, and have the medication lists grown over the course of 10 years? And if they've grown, why is that? Typically, it's because you need to keep down what was once kept down with less medications. And number three, put those two into context with each other. Where would my labs be without these medications manipulating these labs? That's the true size of the pathology. Because you can create more normal-looking labs with more medications. So we are complex. The standard model of care is trained to diagnose the disease and match it with a medication. You have acid reflux, reflux medication, depression, antidepressant, and so on and so forth. This medicinal matching game. We have to look under the sea. It is like the Titanic, where it sees this little chunk of ice. But the true breadth, the true magnitude of the iceberg is underneath the ocean. The training in the standard model of care, we just went through that. The hammer analogy, I'm really not going to do this. But if I hit somebody in the head with a hammer, just light enough to hurt, that's a sick analogy, isn't it? But over time, they're going to get a what? Not that hard, not injury. But a headache, right? You have two options at that point for the headache. You could take Tylenol for that headache, or you could tell me to stop freaking hitting you in the head with a hammer. Ultimately, we have to find out what's proverbially hitting ourselves in the head with a hammer.